Hello, my name's Phil. I'm an IgA nephropathy patient. I was diagnosed with the condition 8 years ago, and 18 months ago I received a renal transplant. Today we're going to be looking at kidney pain, a condition commonly reported through our analysis of social media. This video will explore some of the issues around kidney pain, and I would like to introduce my colleague Matt, who's a kidney doctor, who's going to be carrying out this discussion with me. Matt, it's a very common symptom that's reported by many people on social media that they have kidney pain, and many people say that it's a deep-seated pain in the area of the kidneys in the back, and that it comes and goes, not always there, and often it's dismissed by doctors. So I'd really like you to spend some time talking about, as a kidney doctor, about this issue.
Yes, thank you, Phil. So it was really interesting to me, actually, that this was one of the major symptoms that patients described over and over again, was this intermittent, dull, aching pain in their back over their kidneys that came and went. And it was really, nasty symptom, very pervasive, that interfered with aspects of daily living. And I suppose the reason it was most interesting to me really was that at medical school, doctors and nurses and healthcare workers are often taught that the kidneys don't cause pain. That's what we're taught at medical school. There are only two instances really where the kidneys are known to cause pain, and that is one if you have a kidney stone or if the kidney becomes infected. Conditions like IgA nephropathy, inflammatory conditions in the kidney, we're always told that they don't cause pain. So commonly, and this was borne out in the social media analysis, doctors are very dismissive of this type of pain, and patients are often told that it must be a muscular pain and that it wasn't related to their kidneys. But actually, from what we're seeing over and over again, the fact that it's so well repeated, I think we're thinking more and more that probably it is related to the kidney.
Well, thanks, Matt. And I suppose that with so many people reporting these symptoms, that it's likely to be related to their IgA nephropathy, is it?
Yes, Phil, actually, and I have changed my view on this, having seen the social media analysis. And one of the reasons I think that this pain that people are describing is related to their IgA nephropathy are the other symptoms that are so commonly described around it. And that is that patients in the Facebook group were telling us that the pain often got worse after they'd had a viral infection, an upper respiratory tract infection. And often they'd notice changes in their urine, perhaps a little bit of blood in their urine, or sometimes a bit more protein in their urine when they popped a dipstick into it. And that, the relationship to an upper respiratory tract infection, fits very well with the most recent data we have about the part of the immune system that is altered in IgA nephropathy.
Thanks, Matt. Is it known whether the pain is associated with a drop in kidney function? A lot of people on social media were concerned that when they got the pain, it demonstrated that their kidneys actually might be failing, or that their kidney function might be declining. Is there any evidence to support that?
Well, it's a very good question, Phil. At the moment, we don't have any evidence to suggest that when patients get this particular type of pain, that it's causing a decline in their kidney function, or it's indicative that their kidneys are failing. That said, and now we're in the realms of hypotheticals here because we don't have data on this, because IgA nephropathy is an inflammatory condition, it is possible that if there's inflammation going on in the kidneys that is causing the pain, that at the time the kidney pain occurs, the kidney function might go down a little bit. And one of the really nice things about this piece of research we've done here, analysing social media data, is this particular feature, this particular symptom has been so commonly repeated that it's led us to start thinking about how we can answer that question in a research project. And in Leicester, we're putting together an application to study whether at the times when patients with IgA nephropathy have pain, that leads to inflammatory changes that you can see in the kidney, and we're going to do that with MRI scans of the kidney, or whether there is a decrease in kidney function at that time, or whether there are any changes in the urine at that time. So what we're going to do is invite patients with IgA nephropathy to have an MRI scan of their kidneys, blood tests and urine tests, and then when they get those symptoms of pain, we'll invite them back at that point and do all of those tests again and see if we can measure any changes in the kidney in the blood tests and in the urine. That said, I think it's also important to mention that this type of pain that I'm describing, the dull, aching pain, is very different to the types of pain that patients might otherwise get if they had a kidney stone and if they had an infection in their kidneys. And if you're watching this and you've got kidney pain and it's a very, a nasty, terrible, intrusive pain that's very sharp and radiates from round in your back down into your groin, or if it's making you feel very, very nauseous and sick, or you're feeling very unwell, or you have a very high temperature, you really should go to your doctor and your medical team immediately, because that might require treatment straight away. And actually, the simplest thing to say is if you get pains in your kidneys and you're concerned about them, then please do visit your medical team for a checkup and perhaps a blood test, even if it's just for reassurance.
Thank you, Matt. Now, presumably because this is a commonly reported symptom, and many patients seem to have it as is reported through social media, is there anything that they can be taking to alleviate the symptoms or to be prescribed to make the symptoms better?
Well, that's a great question, Phil, but unfortunately there is no magic tablet that we can give to people to make this pain go away. What is important to say, though, is that from doing this analysis of all this social media data, it was really encouraging that patients are already offering advice to each other that is really kind of nice, common sense, appropriate advice to manage this pain. And some of the things that patients were saying to each other, ways to perhaps deal with this pain, because you honestly can't get rid of it, are to take simple painkillers such as paracetamol regularly while you have the pain, but not exceeding the recommended daily dose. And maintaining an active lifestyle, so regular exercise, high levels of physical activity were helpful. Some patients reported that stretching, particularly early in the morning, was helpful and got them loosened up and made the pain more easy to deal with. And some people found great relief from applying heat patches directly over the areas when they had the pain. There was quite a lot of discussion on the Facebook group about whether you can use anti-inflammatory drugs to treat the pain, such as ibuprofen, naproxen, Voltarol, diclofenac, those types of drugs, and those are called non-steroidal anti-inflammatory drugs. And that's quite a contentious question for the kidney community, actually, because there are certainly instances and certain patients for whom you would not recommend taking those classes of drugs. But equally, there are some patients who perhaps don't have severe kidney disease for whom those drugs are perfectly appropriate and might offer good relief from these symptoms. So the most straightforward and safest thing to say in relation to those particular types of drugs is if you are suffering with bad kidney pain, or any other kind of pain for that matter, please talk to your medical team and your kidney doctors about whether anti-inflammatory drugs would be safe for you to take. And they'll be able to advise you appropriately.
Thanks very much indeed for that, Matt. We now know through the analysis of social media that many patients suffer from this condition, and that if it is dismissed from by their doctor, it can be quite frustrating for them. But they should carry on discussing this with their healthcare team, because although there may not be any right answers, at least their pain can be acknowledged. Further information on this issue can be obtained by looking at Kidney Care UK's website.